If you're looking for a protocol or a bunch of exercises that are going to help eliminate low back pain and prevent it from even coming on in the first place, we've got you covered. Hey guys, I'm Dr. Josh Jagoda, sports chiropractor and jiu-jitsu black belt, and today's episode is going to be about some of the protocols, things I recommend, exercises, mobility tricks that I really recommend patients do to help develop a strong and stable core so that they can prevent injury. Now, this is a great maintenance program, so somebody who's maybe out of back pain, you can use this as a maintenance program, or somebody who's finally built their way up into a certain level of strength so that you can maintain that strength, right? We want to typically recommend that you do this every 7 to 10 days. Now, if you're newer to just getting out of back pain, you may want to do this every 5 to 7 days, but also you may want to split some of these exercises apart, right? We want to make sure that you're able to not only do these exercises frequently, but consistently, and also that if any exercise that we do here trigger any back pain, we absolutely do not want that, right? We could be doing all the best exercises in the world, but the best exercises in the world are the ones that actually help you and don't increase the pain, right? So if you're having back pain, you gotta stop it. You gotta figure out why that's happening. Maybe see a practitioner, somebody who can help you. But I'm gonna share with you my exercises and my routines that I recommend that help prevent back pain and that are going to be really, really good for you. Now, before we get started, we all know that exercises are good for you, and the function of our spine and the ability to create stiffness or strength and resilience on demand, not just walking around with all stiff spine the whole time, on demand is critical, right? So the ability to produce stiffness allows us to generate power and produce force. So this is really valuable when we're talking about strength and performance and being able to stiffen up when we need to stiffen up. But we don't want to walk around so stiff. And one of the problems that we end up doing is that we end up walking around with stiffness and we don't allow some mobility. And also a big factor within the spine is that we have extremely tight hips. If we tend to have really, really tight hips, we're going to end up using more mobility through the spine. And as we know it, we can suffer disc herniations, bulges, and problems within our spine. So part of your routine is not only going to be learning how to create strength within the core, but it's also going to be learning how to mobilize the hips that work best for you. So let's get into the content, let's get into the information. And again, we know that there's going to be a ton of different exercises. There's going to be a whole host of them. I want you to pick and choose the ones that you feel are best and maybe alternate them through a cycle. So for example, you can do them every 7 to 10 days, basically once a week. And then what you can do is that you can do like maybe 3 or 4 exercises before or after your workout, or as a primer to your workout, or maybe on an off day. Maybe do that for about 6 to 8 weeks, 12 weeks, and then switch on the other exercises. And again, we want to maintain our spine. We want to have good spinal hygiene. We don't want to increase our back pain, and we want to prevent back pain to begin with. So these exercises are the ones that are proven to be very, very effective, and the ones that I see in my clinical practice that I recommend a lot of my patients do when they're out of back pain. So many of you are familiar with McGill and the big 3 exercises, and those are exactly what I'm going to start by recommending. Now, before we get into the McGill Big 3 and what they are, I just want to let you know that these are not, quote, discovered by him, but these are exercises that he saw in the lab that generate the best EMG potential and basically the best core stiffening program. So we're not talking about exercises that potentially increase back pain, right? We're talking about exercises that actually help the spine and maintain it without causing injuries. We're going to go through some of these exercises, and I'm going to show you the McGill Big 3, which are basically bird dog, side plank, and the reverse curl. So the first exercise is the bird dog, and basically what we're going to do is we're going to get onto all fours here, and we're going to stack everything over here. And what I like to do with my patients is the big key here is not to overextend, right? We don't want a lot of pressure going into our spine. What I like to tell patients is to find what they call their neutral spine. It might be here, but it's not all the way up here and it's not all the way back there, right? So when we extend our foot, a lot of people tend to do this or like arch their back. I don't like that. There's two options here also where you can create a nice strong fist here and grasp and control a lot of strength through our hand, or we can really reach out. I like to do either or, but what I like to do is I like to kick, and if you notice my foot here, right, it's kind of gonna go into the glass, right? I wanna pretend like I'm gonna mule kick the glass. I point the toe towards my nose and I'm squeezing the front of my shins here, and I'm squeezing my hamstring and my butt, but I'm not extending my spine too much. Here, with this opposite hand, I'm pushing the ground away and I'm going to reach out just like this. I'm gonna reach, I'm gonna get long through the spine, and I'm gonna really reach, and I'm gonna slowly tap and go. And I like to do both sides, but I typically, when I do this, I typically stay on one side or the other. Notice the big key here again is my head position is here. I'm not looking up, I'm not looking down like that. I'm keeping a nice spine and I'm keeping it long, getting strong through the middle of the spine. And that is the bird dog, right? So that's going to be one of your exercises that you can do. Of course, the next exercise is going to be the side plank. We can get up into a higher level side plank or a modified version. Of course, if you have shoulder problems, please pay attention to that because this might be pretty difficult for you. But in this position, we can, again, push the ground away or we can squeeze here. I find that doing this type of position where I'm squeezing is really helpful. I like to put my knee onto the ground and then I like to push up into this position. I sometimes keep this here. If you're newer, you might want to just start here, right? You may even want to go here to this position. But the big trick here is to not let the hip drop like this. We don't want the bend in our spine. We want it nice and strong, and we want to have our shoulder on the bottom side, like almost doing like a row. You want to shrug that row in and come up nice and tall. As you progress here, we can go to 20 second, 30, 40 second hold, but then we can get up to maybe up here like this. We can come up. As long as you can hold a nice, strong, steady spine without it bending like this. Okay, so that's the side plank. Another really strong position from the McGill Big 3 is the reverse curl, where we can place our hands behind our back, just like this. Now what we're gonna do is we can straighten one leg. We can keep it elevated if we want it a little harder, but what we'll do is with our curve in our lumbar spine being maintained, what we're going to do is we're gonna do a curl up and then slowly come down. A big mistake is that people lead with their head like this. What I want you to do is think about you being a flat board here and pulling your chest up to the ceiling, okay? So it'll kind of look like this. And slowly lowering back down. In addition, what this is going to do is it's going to strengthen the anterior neck flexors or the front of the neck here. So what you want to do here, and McGill talks about this, is pull your tongue up to the palate. So you're going to squeeze your tongue up into the palate, and that's going to help it as you breathe through your nose. You really want to try to get the shoulder blades off of here without doing this. So, and oftentimes you'll see people shaking this. While we're down on the mat, I'm a big fan of glute activation and just basic glute activation work. You know, a lot of people, we sit on our butt, we need our glutes for power and performance, but yet a lot of us don't use our glutes enough. So I highly recommend doing glute bridges. I don't care if you're a pro athlete, you're a semi-pro, you're a very active person. I don't think anybody can get hurt by doing glute activation work, and there's different types of it, but doing a glute bridge is really, really powerful. And we can do single legs as well, but basically we're gonna come here and we're gonna come up and down. Big mistake here is that people overextend at the spine like this. I don't want you to overextend at the spine and go like this. Take your feet, drive them down into the ground, pretend like you have a nail. As you do that, you push them into the ground and you lift your hip up, squeeze your butt, and come back down. Looks very easy. It is. But here's the trick. You're gonna do a ton of reps. Most people do 3 sets of 10. It's enough to feel something, but it's not enough, right? So what I want you to do is maybe 2-3 sets of 10 as a starter, and then maybe 2 or 3 sets of like almost max reps. If you can get 30 or 40 reps, then you're probably good enough to go to a single leg glute bridge where you'd be like this, or you would maybe add some weight onto your pelvis and coming up through here. So it would look like this, squeezing, and you really want to feel a nice deep burn into the glutes. Getting a good amount of glute activation is going to help stabilize the pelvis as well as the spine, and that's going to prevent a lot of back pain as well. So another great strengthening exercise that I love, and this is taken from the DNS book, is basically another glute activation. It's basically like a side plank clamshell type of positioning where we're onto our pelvis or onto our side here. We elevate our pelvis here, and what we're gonna do is we're gonna stick that butt back a little bit, okay? Watch my foot position or my hip position. It's gonna stick back. I'm gonna slightly rotate forward so the belly button, instead of facing the camera towards you, is going to face a little bit downward, okay? That creates a little bit of rotation, and we're going to eccentrically load the glutes up here. We're gonna keep this high, nice and tight, and we're gonna tap and extend all the way up. Tap the hip and extend up. Nice and strong row here through our shoulders. Nice strong grip strength here. Tapping and going. And you're gonna do a lot of reps. When I first injured my lower back, I was able to do maybe 4 or 5 or 6, and then I had to stop because it was so fatigued. After some time, I was able to finally get to like 3 sets of 12 or 15, and this is something that really, really helped my lower back, is getting a lot of side planking with that glute activation. So this is taken from the DNS, and it was really very valuable to help prevent lower back pain and get that glute to really start to fire so that I can prevent the back pain from happening. So one of my favorite exercises also is learning how to hip hinge and practicing the hip hinge often, okay? It's really, really common where we learn how to spinal hinge, as I mentioned, but we want to learn how to hip hinge. So from here, what I like to do is get into this nice athletic stance, just like so. And then what I will do is come here and I will, with my feet, I will rip the carpet in half. What I like to do is pretend you're at the ocean. A wave comes up and then a wave recedes. And now your feet are stuck in the sand or in the mud, right? And what do? We tend to wiggle our toes into the sand, right? And so when we tend to wiggle our toes into the sand, we're kind of like sinking in, and we're like cinder blocks in the sand. So we can't move our feet, but yet we're using our feet to palm the basketball, so to speak. We're palming the grip of the ground. So we want to squeeze our feet to the ground. This can be done barefooted. This can be done on rubber. And what we're going to do is with our legs and our hips here, we're going to rip the carpet in half or rip the mat in half with our feet, okay? We're going to come in, our nice athletic stance. We're going to tuck our butt backwards, so like almost like closing the sock drawer, right? We're going to tilt back and we're going to rip the carpet in half, and you should start to feel it right through your glutes. We're going to hold this for about 3 seconds, completely extend out of it, and then repeat that a bunch of times. This can be done with a wooden dowel or with a stick in the back so that you have good spinal posture. But what I like to do is just repeat this over and over so that we can get good activation of the glutes from the ground and learn how to transfer forces from the ground to the spine, from the spine and to the ground. One of my favorite exercises is to do a single arm row. The reason I like single arm rows is that it helps to build the posterior chain. It's great for the arms, it's great for the back, and it really allows us to learn how to use our hips and stabilize. It's basically a full body, but a posterior chain exercise. So you can do a single arm cable row, you can do this in a split stance, you could do this a bent over row, but either way, I'm going to show you just one of my variations. So I really just think that rows are really important. And if you're not yet at the strength where you could do a single arm row because of maybe too much rotation, then I would recommend a bilateral or 2-arm row and then work up to a single arm row. But I like to use kettlebells. I can get into a lunging position here. I can use my own arm here, or I can use a bench, however you feel comfortable with. And I like to come in and I like to just row and getting that upper back. But if you see my spine, it's almost like a slope, right? Like a skier. It's not bent over like this, right? It's not overly extended. It's nice and strong, and I'm getting this real good power through here. I have to be nice and strong and stable in my feet in order to row here. So that's going to be something that I really recommend. Not really talked about very often is the rows and the lats being part of the integral part of rehab, but I find that usually when people stabilize the posterior chain using the lats, they get phenomenal results. As I mentioned earlier, the hips are really critical for being mobile, and if we don't have either mobility exercises or something that helps stretch out the hips, it's going to be really, really troublesome. So we need to find strength and power through the hips, which is also part of the reason why we do some glute activation work, but we also have to find mobility through them. So I like to do a 90-90 position where we come in. Now, if you're not this flexible or anything like that, and you can't do this, that's okay. We can put a towel under here and we could start moving through here. But I might just stay here and just kind of like rock back and forth. I might come into this type of position where we do this. And if you can start flowing, you can start going through all these positions. And what I like to do is you can hinge at the spine, or the hips I should say, not at the spine. We're not kind of rounding like this. We're hinging, we're staying nice and tall, we're rotating, and we could even just move back and forth. Heck, if you're not that flexible and you just want to start with this is another option. But getting the hips to be in this 90-90 position and do other things that inherently help hip mobility is going to be really critical for your spine. One of the most important exercises that I think is absolutely mandatory for everybody, no less if you have a spine or hip, is going to be a hip flexor stretch. The hips are super important, again, for mobility and power, and they actually insert directly into the spine, and they also have insertions into the diaphragm. So it's going to affect not only your breathing, oxygenation, your spine, your hip, your power, your force production, and your performance in all facets. This is one reason why I think it's super important to have hip mobility as well as hip flexor work. And when I say hip flexor work, I mean also having somebody potentially even work on your hip flexor who is skilled at doing so. It really makes a huge difference. It has helped me in my career. It has helped a ton of my patients. And I can tell you, if you do some of these stretches, this is gonna help you. So we can do this in a kneeling position where we're kind of into this position, right? And when we're in this position, what I like to do is I like to slightly overstep here, right? So you can see we're not quite at 90-90, but I'm gonna squeeze this bottom side butt down, and I'm gonna drive my pelvis this direction, and my belly button's kind of forced this way right now. What I like to do is, like, instead of forcing this direction, I want it to face this wall, okay? So I'm gonna kneel into this, I'm gonna turn my spine, and I'm gonna squeeze my butt here, and I should feel a nice little stretch going down. If that's not enough, maybe you take a small little step through, going here. To get a little bit more of a stretch, as you can see, my foot is pointed downward this direction. I can reach up, I can hold here with two arms, I can reach over this direction, and I can do that. I can rock a little bit, but what we don't want is overextension or overflexion. I want you to imagine that somebody's kind of pulling you up by your head or your hair here. And we're getting long through the spine, but driving that pelvis forward. And what we could do also is, as we take this foot, we can do like a little hamstring curl and pull this hamstring backward, right? As it sits on the mat. And that helps create that effect where we get a little stretch in here. From this position, we can even come up into a lunging pose. We can stay low. We can do the same thing. We can do kind of that warrior two. We can put that leg down type of position. We can kind of get a little bit, and we can twist through the spine a little bit. So we're getting different angles of that stretch, but also we can also get down onto this position where we're legs or hands are on the inside of our knee. Just to see you on this side, it's kind of like this, right? So we get a little bit of that hip opening here. We can raise this up and down. If we're in this position, for example, what we can also do is we can rock back and forth. I just want to let you know that there are definitely major different ways to get this hip flexor to release. This is going to be phenomenal. You sit, you want power, you want strength, you want mobility. It all comes from this, and this is absolutely a non-negotiable. I can promise you, I have not seen anybody in my entire career who hasn't had a benefit from this type of stretch or this type of muscle work. Finally, one of the things that I highly recommend that most people neglect is spinal health within the thoracic spine. So we're talking about the mid-back here, okay? And when we talk about the mid-back, we need to have good extension as well as rotation. So we can grab a band, we can get into this kneeling position, we can come here, we can open up, we can do the open book, closed book, we can have this rotation type of positioning where we do that. We can use a foam roller that we have right over here to get to mid-back rolling. But another really great way to hit both the hips as well as the mid-back is to grab a prayer pose and grab a weight. Why would I grab a weight? Now, I really like to do this one typically without my shoes, but surprisingly, having a weight is going to be this position. So this is kind of like the prayer pose, right? We kind of know this, we can rock back and forth and stay on our toes, but as you get more seasoned at this and as you take off your shoes, it gets harder. Now, what this does is it works the hips, but it also has to keep us erect, right? We can't be down here like this. We have to keep our spine nice and strong. And a little cheat code for here is grabbing a weight, 10 pounds, 15, 20 pounds, whatever works for you, and you can just walk through here. And instead of, as you are newer, you might want to rock back and forth, right? But as you get stronger, you might have to just sit here and breathe through this. Working a nice, strong, stable spine here. Working your hips. To get out of this, you might feel a little tension in the hips, but you're going to drop the weight, and then you might just have to drop the hips down to the ground and then come out. So that is the prayer pose. Again, a little cheat code here is to use some weight to help drive you down. And if you're still not ready for that, just cycle back and forth or rock back and forth so that this way you're not just working too hard on that area and you're getting some mobility through those hips. That is the end of this type of maintenance program when it comes to exercises that I highly recommend. Of course, there are other protocols like decompression work where you are potentially hanging from a bar, you're decompressing your spine. At the end of the day, there are millions of different exercises and there are millions of different protocols. But what I want you to do for you is to pick some sort of exercise that you can do for roughly 10, 15, or 20 minutes. I want you to build a little bit of a sweat, a little bit of heat, and then I want you to feel some strengthening and stability happening. I would highly recommend you do at least 1 or 2 different strengthening exercises, but I also highly recommend that you also do some of the mobility exercises within the hips. So pick 2 of each and see how that fits for your schedule, for your time budget, and alternate the exercises. This doesn't have to be a massive workout program, but this is just something that I would recommend that would help you maintain your spine. All right, guys? Thanks again for stopping by. See you again.